rahmatullahi ta'ala wa barakatuh. Today we're talking about the triage station and
I'm going to talk about the triage levels and emergency severity index, which the abbreviation for it is. So, first of all, we're going to talk about introduction of triage. It's a very meaning source. So, the process of determining the order to treat a trauma patient based on the severity of their injuries. So, when the patient came in the emergency department, he will meet a registered nurse to make the nurse assess his condition. So most patients entering an emergency department are greeted by a registered nurse who will perform a brief evaluation of the patient to determine the level of acuity of priority of care. And the role of the most registered nurses is to make acuity determination and set priorities, to not make the patient late. And we're going to talk about the appropriate of care and triage level. So, standardized triage levels are developed within each emergency department. Most common triage systems consist of 5 levels of acuity. Most of country use these 5 levels. So the level 1 which is the resuscitation, and level 2 which is the emergence, and level 3 which is urgent, and level 4 less urgent and non-urgent. So we have now the first level of triage, which stands for resuscitation, and they color it with blue. Patient in need of immediate treatment for preservation of life need a fast management, for example, cardiopulmonary resuscitation, also rescue breathing. So it's basically requiring immediate registered nurse, and any delay in treatment is potentially life-threatening, and the nurse should in the second when the patient arrived, they should evaluate or assess the patient. We have now common conditions for this level. Include cardiac arrest and severe shock, also LOC, which is stand for unconscious. And we have cervical spine injury, and this is a picture which represents this condition. And we have multi-system trauma. Now the second level in triage stands for emergence, which colored with red. So the patient required registered nurse assessment or evaluate within 50 minutes of arrival. Conditions include head injury, severe trauma, conscious overdose, chest pain, unstable vital signs.
now I'm gonna continue with the last 3 levels beside Nawaf. The third level of triage stands for urgent. The color is yellow. Means patient with serious problem but apparently stable condition. This level, patient requiring registered nurse assessment within 13 minutes, means have hours of arrival. Now, the common condition of the third level includes the moderate trauma and history of seizure, also opposed or neglect, for addition, vomiting and moderate asthma. Now, the third level of triage stands for less urgent. The color is green. Condition with a mild to moderate discomfort time for nurse and physician assessment up to 1 hour time. Condition like head injury, no vomiting and no distress, also depression with no suicidal. Now, the last level of triage stands for no urgent. The color is white. This level means minimal pain, no high-risk features, minor symptoms, low risk. Conditions include minor wounds.
Now, after Ahmed finished the triage level, the last 3 triage levels, now we can come of this topic, which is emergency severity index. So, what is the definition for it? So, ESI is a 5-level triage developed by emergency department physicians and nurses. So provide a reliable, valid tool for determination of acuity. So it's describe parameter for rapid identification of their who need immediate care. So what is the benefit? That question came across your head. So improving patient flow in a hospital emergency department based on rapid sorting with projected resources and operational needs. And there is a common sentence between registered nurses, which is get the right patient to the right resources in the right place at the right time.